Hello, my name is Dr. Ashad. I'm one of the doctors in NMC Majaz Clinic, Sharjah. I have experience in various fields such as start from upper respiratory tract, lower tracts, and GIT as well. I do been experienced in the IND is called insertional drainages, pus discharges, and the dressings as well, which includes the burn dressing, which in primary cases we used to do. Yes, there's a question rights in people with what's called NAFLD, it's called non-alcoholic fatty liver disease. Let me explain you, but before explaining that, let me explain what is liver. Liver is an organ which is located on your right side of your tummy and which is covered by the ribs, because liver is so protective, it has to protect by the ribs. And when we talk about the function of the liver, it's trying to produce bilirubin, that is called the fatty substantial breaker, which is carried in the gallbladder. So when you talk about the liver, and its functioning is to prevent your from the infections, from toxicities, and it has an enormous function such as vitamin K production, as well as cleans your liver multiple times. So when you talk about the NAFLD, that's called non-alcoholic fatty liver disease, it has categorized into two. One is alcoholic and non-alcoholic. Currently, I'm going to explain you what is non-alcoholic fatty liver disease. It's a condition in which the liver get accumulated by the fats, only fat, such as triglycerides. The normal triglycerides should be less than 150, but in the patient who reach more than 200, it has to be treated as fatty liver. What is called fatty liver? The liver get accumulated by the fat. Liver do had some fat, but when it started accumulating over, it can lead to NAFLD. It has been categorized in multiple fields, such as when I said about non-alcoholic, if the fat get accumulated, it can lead to non-alcoholic steatohepatitis. Let me explain what is steatohepatitis. Steatohepatitis is the accumulation of fat in the liver when it exceeds more than the liver wanted. If it leads to that stage, it can lead to a condition called fibrosis. Let me explain what is fibrosis. That the liver has a cell called hepatocells. That is the cell to produce your liver to function well. When that gets disturbed, it can lead to a condition called, really a serious condition called cirrhosis. When you talk about cirrhosis is the damage of the complete cell that can lead to further complications that the patient experiences, such as swelling in the limbs, water in the tummy, and increasing of hypertension. Let me explain all the stages of NAFLD. As I said a moment before, it has categorized into non-alcoholic, fibrosis, and cirrhosis. Let me categorize into, when you talk about the steatohepatitis, that's the fat in the liver, it can categorize into three stages, that is stage 1, stage 2, and stage. That's called mild, moderate, and severe. Fatty liver 1, fatty liver 2, fatty liver 3. Just to be understanding, I have seen people, when they go for an ultrasound, they go for some other reason, like, some stones, but they'll end up in getting the fatty liver grade 1, fatty liver grade 2. You might have read somewhere, you might have seen one of your friends or your colleagues might have telling you, having this fatty liver. This is because stages. The stages has the progressive process. Initial stage, all the people doesn't have any symptoms at all. 25% of the population doesn't carry any symptoms because it's very silent. When it goes to stage 2 and stage 3, there is a progression in the liver that can lead to fibrosis. Smoking, who has a poor activities, such as most of the people here sedentary lifestyle, because what we call as a desk life. You sit in the car, you go to office, you sit in the desk, you come back, you sit in the room, check your mobiles. It's kind of sedentary lifestyle. There's poor activities, there's no activities. And the major contributing for the risk factors are hypertensive, cholesterol, and diabetics. This is we also called as metabolic syndrome, because metabolic syndrome, it's also a triggering factors and contributing factors for the fatty livers. That's a good question you asked me, why fatty liver is dangerous, because nowadays most of the people are unaware of that. What is fatty liver and what are the consequences they will face when you reach a certain period of time. Let me explain you, even you can identify yourself by looking at your mirror. Like, when you have a dark on your neck, especially on the behind of your neck, and you have a skin tag, that is called, most of the people who have seen it, that is the initial stage of you having a metabolic syndrome, such as diabetic or a cholesterol. In that reason, that can lead to further complications if a person is inactive and not moving much, and he's consuming food which is not needed to his body. Overtaking is the cholesterol get accumulated in the liver. It can lead to dangerous substances, as I said, cirrhosis in a previous talk. That's a good question you asked me, like what are the investigation? Before going to the investigation, I like you guys to rule yourself, where are you standing? For example, if a patient who comes to me is BMI, which is called body mass index, that is means your height and the weight, it comes as body mass index. That should be 18 till 25. That's a normal range an individual, an adult male or female should have it. When you scale yourself, for example, if your patient's height is 170 and the weight is, for example, more than that, which is around 90 or 80, it comes into BMI. Let me give a small calculation, and it's very simple mathematics. 170 divided by 100, how much you get it? 70. The individual ideal patient of that person should be 70. When you cross that, automatically you are in the stage of getting metabolic syndrome diseases. As I said, diabetics, cholesterol, and fatty liver. So how you can prevent it? I'll be explaining what are the lifestyle you need to do it as well. Before that, let me give what are the investigations you can check yourself. You checked it. You feel like I'm a little overweighted. So what are the blood tests you need to run and whom you need to talk regarding with this to get a clear idea of what you've been facing? You need to visit a doctor and you need to ask, doctor, I feel I'm overweighted, what I can do it for myself. So the doctor will explain you, he may check you by examining your tummy, because liver can palpable as well. That means what I mean by palpable, we can feel it. When you can touch and feel it, when the size is over than the liver has it. So initially the doctor will check your test called alanine amine transferase. It's a blood test. It's also, you might have come across, maybe when you're checking your blood, it's called SGPT and SGOT. It's a part of the liver profile test. It do have some other enzymes, but SGPT and SGOT are the essential marker for the liver enzymes. Once the doctor's done it and he feel it and there is the increasing of SGPT and SGOT, he may run a test called ultrasound about complete abdomen. In a complete abdomen, see, when you take an abdomen, we have a liver, we have a spleen, we have a tummy, which is called a stomach. We have other internal organs as well. If I can name it, like a pancreas, your food pipe, your other internal organs such as your appendix as well. You can visualize it in ultrasound. So the doctor can visualize it, or the fatty liver stage has it. When the ultrasound comes, in case ultrasound shows, you remember read possibly echogenicity. Let me explain what is echogenicity as well. What means that there is the accumulation of fat in your liver that shows that grade 1 infiltration echogenicity, or grade 2 or grade 3 as it is. When the doctor feels that, he may run a test called NAFLD, that's called non-alcoholic fatty liver disease score. What it means is your BMI, I explained you what is BMI, your age, and I explained what is SGPT and SGOT, along with your platelet. It brings in the category score. By that, he can categorize you how much you are affected by the fatty liver. And next comes very important, and it runs all over this UAE. It's called FibroScan. That is a specific test. It's not a golden standard test, but it's a specific test to tell you, it'll be focusing on your liver and tell you how much fat you has it. When you talk about the fatty liver and the FibroScan, it has three things: how much elasticity your liver has it, and how much stiffness you have it, and there is any changes in the cells of your liver. So FibroScan will tell you what stages you are and how much elasticity. What is meant by elasticity and the stiffness? The liver has to be its moderate shape and the size. When it gets stiffness, what it means by stiffness? When the cholesterol gets accumulated in the liver gets rigid. The liver gets rigid, but for example, this is a liver and I'm covering with the fat. What happens with the functioning of the liver it doesn't work because just get conquered by the cholesterol. What I want to function, it doesn't function it. So that time, the enzymes will elevate. That's called SGPT and SGOT, that is elevating it. So it will get thick and get harder. So the FibroScan will help us to know it. The final test, it doesn't need to do all the time, but when you come across this test, the doctor will help you what you need to do with. That's called liver biopsy. Everyone has a paranoid when you heard the word biopsy. I just want to tell you during this time, biopsy doesn't mean it's always need to be cancerous. What's mean biopsy? What they take in the liver? They take a small tissue from the liver and they run the test because, as I said, liver has a cell. So they will be knowing it, how the liver enzymes and how the cell, whether it's alive or it has damaged or it's causing you, it's kind of, and I'm so sorry to say this, it kind of died. So during the biopsy, and the biopsy can help you with the treatment, but for the for the fatty liver, we can treat it before reaching the ultrasound itself. Yeah, before coming to the management, let me tell you the lifestyle, what we can do with. See, everything comes on us. It's our body. When we can tackle it and manage it, we no need a special doctor or a management done in that time. So what are the lifestyle modification we can do with? First thing, as I said, the BMI. When you're overweighted, you can scale yourself. Everywhere you can buy a scaling machine. You can scale yourself. And you feel you're a bit overweighted, and according to your height, which I call BMI. So you feel overweighted, try to cut down your exercise. Try to do some exercises. I know it's really busy nowadays. People having a busy schedule, but try to yourself some time, such as the early morning, or around give yourself 30 to 40 minutes. So you can make yourself refreshing it. When you do an exercise, your entire body will move and the blood supply will never get stagnant. And some patient experience morning constipated, gastric, because the food what you eat in the late night might not have digested. So when you do a regular exercises, I request my patients, my people, to at least start doing a running and walking and do a jogging in early morning to any of these three and make it for 40 minutes. What do you mean by 40 minutes? Because the body has to get tired, it has to get sweat. Any exercise which has a sweat will really help you to reduce your cholesterol. Then comes what you eat. There's a say, what you eat that impacts your body, right? Try to eat the colorful vegetables or fruits. When we talk about colorful vegetables, such as comes the carrot, beetroot, cucumber, vegetables which is called okra, and a pumpkin as well. When you talk about the fruit, apple, there's an olden says, apple keeps away the doctor, but I tell you, when you get 2 apples, you can prevent your liver as well. So next comes, it's quite easier, and it's very favorite drink to me as well, black coffee. When you talk about black coffee, without sugar and the milk, it really wonders to you, because what the black coffee has it has really an enzyme that will clean your tummy as well as your liver, because as I said, liver occupied by the fat. You take your black coffees, try to clean your liver. You might have experienced any time in your life, and you may try black coffees. When you drink, you might visit it to the bathroom quite a lot, 2 or 3 times. What it means is it cleans your tummy, because it too has a tendency of cleaning your tummy. By that, you can remove the toxicity. Next comes, the next what I want to tell you is, try to reduce your sedentary lifestyle. If you've been a desk person, everyone is desk, because you sit in the car and you reach your office, you'll be desk. Try to give yourself some time. There is most of the nowadays smart watches has it, when they'll keep an alarm, like within a 30 or 40 minutes, I need to walk. I need to give a small walk to myself. Once you reach back home, try not to eat and try to go search your bed. Try to sit, try to talk to your family, and try to go for a small walk, and then come, have a shower and sleep. By this, we can prevent it. I like to say there is a study which has happened in the London Bridge. What is called London Bridge? It's a study, it's called London Double Decker. What this means is, there is a bus, as you see in London, there is a buses or double deckers, right? So what happens? The driver who sits and he drives, and the conductor who goes ups and downs. The lifespan of the conductors and drivers differs, because the guy who sits and drives has reduced his lifespan. What is the lifespan? The living of the individual person has decreased. When you talk about the conductor, because he was going up and down, he's doing an exercises. By that, yes, the lifespan its lifespan of increasing his age is got better. What I'm trying to say in this is, when you try to lose your weight, you're increasing your lifespan of a year ahead. For example, if you're a 60s, you're ready to lose your weight of, for example, 79, you're into 78, you might increase your tendency of living longer. I hope it makes you clear how do you need to do it. Then comes your activities. As I said, the early walking, jogging. Try to do some activities. Nowadays, everything comes in your mobile. Every handies, like your games, your sports. But try to do sports, such as any form of sports. My passion is towards the football, and your passion is towards the cricket. Your passion is the table tennis. You can do whatever you want it, but make yourself a schedule that you have to do this. See, health is very important. And, when you're healthy, you can work. You can have a wonderful life, and along with, you can have a cheerful and a long, lean life. Let me tell you about the management as well. What the management, see, as I said, the lifestyle modification, if you're trying to do it, you are half across of your fatty liver. When I talk about the management, first comes when you meet a doctor might give you a medicine, such as first you're going to tell you to reduce your weight and reduce your intake of the carbonated items, such as burger, junk foods, which is carbonated, which comes in the form of any form of flours. There's always a say that in 3 things, all the whites are dangerous, such as sugar, salt, and which is called the flours. These all the white flours are really dangerous, so we need to avoid it. And when it comes to the medication, what he might give you, first thing is regimen. Second, if you couldn't fulfill the regimens, and despite your regular exercises, and you couldn't cut down your weight, and you couldn't eat healthy food due to multiple reasons, he might give you a medicine called a vitamin E. This is called an Evion, 400 mg he might give you, because what the Evion does it. Let me explain that as well. It's a strong antioxidant. It can prevent your liver by getting affected. Everyone has vitamin C. Yeah, vitamin C has a citrate. It reduces your immune system works, but vitamin is much more stronger. Can prevent your liver by reducing your cholesterol. Then comes, he might give you a medicine called pioglitazone. I'm not going to much more deeper for this now. It's a medicine. It reduces the fat in the liver, so your liver can have been prolongation of the life of your liver much more better. Yes, what was my takeover message in this? See, I like to brief it just for a pocket paper, so you can carry it, you can hand it wherever you want it. What you need to do with it, you need to reduce your weight. And I told you a simple max, heighten the weight, reduce you of that, and what comes it in case, for example, you're overweighted. In that, I like to say, how do you categorize for the male and the female as well? When talk about the male, your height is 171 and minus 100, your weight has to be that. In case of female, 171 minus 105. Okay, and in that, we can categorize it, what I've been standing, which scale you need to cut down on that. And if you've been noticing any sort of blackish on your head, especially behind your neck, on any skin tag, it's a clear sign of a metabolic syndrome. I hope you might be familiar now what is metabolic syndrome, right? So the next is diet, exercise, make yourself a goal, and a schedules. I know everyone has a schedule of the busy in their work, but I request you and I rather recommend you, try to make some schedule. At 40 minutes, I'll do some exercises. I need to have 1 cup of coffee in the morning or the evening, and an apple in a day, or a fruits and a colorful vegetable as well. And if you're a red meater, I request you try to reduce it. I'm not telling you to stop it, but try to reduce the intake of red meat. So if you are in the category of higher BMI. And then my last I want to say is, health have to be credited. We can't take the health. I can't give you the health, right? You have to perform it, so you can credit yourself your health. And nothing comes easier, right? We need to work. You've been working very hard in your work to get your promotions, get into a good profile in your portfolios. I request you, as a part of your health, liver enzymes will work really, really bad when you're not consuming a good amount of diet and exercises. So I strongly recommend you follow the diet and make a schedule on yourself so you can have a wonderful life. And as a new year is coming now, I request you, as a new year, make a schedule, make a plan out of it, check yourself in the mirror, how do you feel it? And when you start doing exercises, I'm truly telling you, you feel much more happier.